Welcome to part 2 of 3. In this section, we will be discussing the well older adult. When we're discussing the well older adult, it's really extremely important for us as physical therapists to become involved in promoting wellness for the healthy population. We really are one of the few disciplines with that potential to influence the destiny of so many other older adults. And what do we know? We know the older adult is capable of adapting to an exercise stimulus at any age. If you think back to all of our classes and lectures and labs before our spring break, we really discussed how important it is to do high intensity activities and that those are the guidelines and recommendations from multiple sources. So we can work with that older adult to really provide that exercise stimulus that's extremely important and that high intensity. It is never too late to encourage that strength and flexibility program, the balance programs, the endurance, the functional capacity training. So the results really enhance psychological well-being and self-efficacy. It's not just about functional mobility. We want to improve the individual's feeling. How are they doing overall? And then that self-efficacy. Do they believe that they're going to be able to improve? Do they believe that they're going to be able to get better? And that's extremely important and a really big part of any sort of rehab for basically all individuals, all older adults. So we're going to go back and revisit that functional markers category that we discussed in part 1. So part 1 talked about that frail or failure older adult. When we are discussing the well older adult, remember we have those two categories. So we have the fun category, which is at the very top of that slippery slope, and that function category. So we want to go and try and push our patients towards that fun category. So in consideration for that, let's look at the function category first. So this individual, timed up and go could be pretty good, around 9 seconds, but it could go up to about that 20-second time frame. Gait speed, we are increasing that gait speed from about 9 to 1.5. Again, it's a good category, it's a good speed, but we want to push individuals above that. 6-minute walk, again, we have some distance, much improved, still not up to those higher norms, higher level norms. 4-score step test, 10 to 15. So we're starting to have a little bit on the lower end, so we might have some areas to improve. That Berg, around that 46 or a little bit higher, DGI up a little bit higher, and then that 30-second chair rise also starts increasing. Now, those individuals that are able to be in that fun category, again, remember, these are individuals that are able to perform all activities without any sort of modifications. So these are folks that are doing a timed up and go in less than 8 seconds. That gait speed is above that community ambulation of 1.5 meters per second. These people are walking a 6-minute walk higher than 480 meters. You know, we have a lot more, and that should say above 180 meters. 4-score step test, again, it's fast. So that 4-score step test, it's going to be done in 10 seconds or less, right? Or less than 10 seconds. The Berg, it's almost right at the top. That DGI is right at the top. That 30-second chair rise is above 15. So it's showing good balance, good gait speed, good lower extremity strength for all of these activities. So these individuals are not going to have difficulty with their functional mobility and thus being able to participate in anything that they would like. A substantial portion of physical difficulty that's experienced by older adults really can be prevented by an adherence to a program of very simple activity. We want to make sure that we prescribe an appropriate exercise program at an appropriate intensity. That exercise program has to include information, it has to include activities where the individual is actually going to participate. We want to make sure that our individuals do things that that they would like to do, so that they can carry on and carry over the activities that we're teaching them. Now, when it comes to the well elderly, we can really look at the definition, right? So the definition of that well elder adult is someone that's living in the community who is safely accomplishing all or most ADL independently and would not significantly benefit from rehab. So the individuals might not need specific physical therapy, but these are folks that have chronic diseases, but the disease doesn't preclude independence, and it also doesn't preclude participation in physical therapy. So as a clinical example, I have a client that, in fact, he just reached out to me and he is functioning very well. I would put him at that very high end of that function, almost the fun category, but he wants to be able to do a lot of higher level activities that he was doing previously. And he's finding that he still has a few limitations. So he asked for me to come back in and work with him to really go beyond that function category up into that fun. He wants to be able to participate in higher level activities, do higher level balance, and really work on his strength so he can participate and go back to his bowling, go back to these other activities, and he's working still as a flooring salesman, and he's close to 80 years old. So the goal is going to be kind of push him above and beyond the basic mobility and really try and get this individual to be as functional and be able to participate in as many things as possible. Now, today, the leading cause of premature death and premature disability are heart disease, stroke, cancer, and trauma conditions. But these are largely influenced by lifestyle factors, right? We know that stress, diet, exercise, smoking really impact some of these conditions. So the ultimate goal is to try and make sure that our older adults are able to participate in as much as possible, and we want to encourage some of these activities. So there's been a shift in that leading cause of death from disease that could be controlled only by public health and medical intervention to overall these conditions that could be significantly influenced by making simple changes in behavior and lifestyle choices. So again, a lot of what we do is education and making sure that our older adults know this piece. So to reduce the potential, overall, what we want to do is provide that focus of reducing the potential years of life lost and to ensure better quality of life over an extended lifetime for our older adults. So that health promotion focus, that disease prevention, as well as medical care, is to reduce the potential years of life lost. And we want to ensure better quality of life for our older adults. Now, when we're looking and talking and discussing health, there's some common terms that are used to describe health. You'll hear some of these, right? So holistic health, wellness, and self-cares. Let's go through, it's just going to be a really quick component, but we'll talk about the descriptions and the differences between both of them. When we're discussing holistic health really encompasses the whole person. We're talking about the physical well-being, the psychological well-being, and that spiritual well-being, where spirituality really refers to a direction or a feeling of purpose in life, and it's really not necessarily looking at the individual's religious beliefs, but they're components of the individual. So the holistic health is really like that a triangle, right? You have the physical component on one side, the spiritual component on the other side, and then really that base is that psychological component. So that's the way that we can look at each section representing a side and making up the individual. Wellness overall is really a complex and dynamic state. It involves our ability to adapt physically, to adapt psychologically to threats, and it can be considered our current state of health, so where we are currently, right, plus our biologic components, our psychological components, and our social and emotional components. So all of these factors contribute to our ability to maintain health and equilibrium. So if we look at the next slide, we can really consider wellness as this current state of health is what we see. It's like an iceberg, right? So what we see is that current state of health, but we have all of these other pieces that make up that bottom part of the iceberg that we don't see, right? So we only see the small part, that current state of health. But all of these other lifestyle factors, the psychological properties, the philosophical beliefs really are the basis and the foundation of how we currently are presenting. So those lifestyle behaviors, things like nutrition, exercise, stress levels, substance abuse, psychological properties, things about what motivates our health-related behaviors, and then our philosophical beliefs is about spiritual interpretation of life. Again, all of these things ultimately shape our behaviors. Now, self-care, on the other hand, is the practice of activities that individuals initiate and perform on their own behalf to maintain life, health, and well-being. When we're discussing self-care's self-promotion, right? 20 years ago, 30 years ago, the Public Health Service, the U.S. Public Health Service published health objectives for the nation. And what it did was it listed goals for reducing most causes of premature deaths and disability in the country. Now, the objectives were grouped into health promotion, which is that fitness component, health protection, which is safety assessments, and then the preventative health services, which is education. Now, I want you guys to take a moment and think, okay, this is 30 years ago, and it's still the premise of this U.S. public health services. As physical therapists, we maintain a huge role in each one of these components. It's really what we do, right? We really want to promote health. We want to improve safety with the individuals. We want to provide preventative services. And most of our treatments really become education about all of the components. So we really are in this great opportunity to help our older adults as much as possible. Now, our role as physical therapists, right? By virtue of our education and the vast numbers, we're in this key position to provide quality health promotion services to clients in the roles of caregivers, our teachers, and health advocates. We have a really big role in the world of providing and promoting wellness to older adults. Now, when we're discussing the well older adult, we also have to talk about some specific health promotion issues that concern that older adult. And it's important for us to keep that in mind because we will get questions. I often find that people ask me for opinions and ask me for information. So our job is to really understand those health promotion issues and help protect our clients, right? So we want to protect them from quackery versus alternative medicine. So as you can look at it as victimization of the elderly. The National Institute of Aging actually lists some of the common ploys of dishonest health products and promoters. So it's important for us to know what's out there. Now, things like the Healthy Living Catalog that you see here, Dr. Leonard's catalog, it's actually a double-edged sword because there are a ton of items in these catalogs that are extremely important and very, very beneficial. There's also a lot of items that promise a quick cure, promise a painless cure. They offer the secret formula that's available from only one company that doctors don't know about, right? Scientists have made this medical breakthrough. So they advertise that a product has all of these medical uses, which oftentimes is not the case. So we have to know and understand which components are viable and appropriate and kind of help guide our patients. Other health promotion issues, providing access to healthcare providers that are skilled in working with the older adults, encouraging our patients to be cooperative and report details accurately. Sometimes they're afraid to discuss certain key aspects. So that's why for us as physical therapists, we want to ask as many questions as possible so our clients can know that it's okay to talk about some of these components. We want to make sure that we teach our older adults ways to assess their care, to encourage assertiveness also when they're not satisfied. So if they're not satisfied with the interaction with a doctor or an individual, it's okay for them to voice that opinion, right? There are some points that we can improve and we can follow basically for an older adult to follow when they're selecting or evaluating healthcare providers. So these are just questions. I'm going to leave them here for you. You can pause the video and read through them. But these are questions that an older adult can ask themselves to determine whether or not that healthcare provider is going to be appropriate for them. We also want to make sure that we encourage our older adults to enhance their ability to overcome barriers that inhibit successful participation in health promotion programs, such as fear of failure, denial of symptoms, perceptions of difficulty in initiating goals or in attaining goals, and believing in luck is the major determinant of good health. It's definitely much more than luck. You have to work at having good health, right? We also want to de-emphasize the person's perception of the program's difficulty instead of emphasizing the benefits. The key is people know that exercise and activity is beneficial to them, right? They know that. They don't need to hear that. We want to de-emphasize the perception of the difficulty of the program. Okay, if this activity is too hard for you to do, what is going to be not as hard, right? Or let's do this task. Was that very difficult? Were you able to accomplish it? Right, so that's what we want to do. We want to help change the perception of the individual in terms of beginning an exercise program or an activity program. We also want to anticipate and plan for changing needs that are relative to longevity and potential health concerns for that older adult, right? So some of these components are really important. Things like changing living arrangements, death of a spouse. Sometimes individuals might have questions about some of these things. So you might want to have some resources available when you're talking to that older adult. So that objective of health promotion is really for each individual to reach and maintain his or her optimal functioning. So we're going back to, again, week 1 when we were discussing optimal aging, and that's really